Female hormonal balancing patients will probably make up the vast majority of the patients seen in Biltmore Restorative Medicine. All women will experience changes, if not an entire decrease or no production of hormones as they get older, particularly the sex hormones, testosterone, estrogen, and progesterone. And what I like to point out is there's a balance, that women need some of all three of these hormones, estrogen, testosterone, and progesterone. Oftentimes women are told they don't need testosterone or that testosterone is going to make them manly. That's not the case, especially when done correctly. I like to point out to my OB/GYN friends, particularly the obstetricians, that if it wasn't for testosterone, they might not be delivering many babies because women might not be getting pregnant. But testosterone also plays another role with women besides libido. It helps them with their muscle mass. And we get asked by women all the time to help them lose fat. Without muscle, you can't burn fat. And so it's vital that women understand as they get older and lose their testosterone that their ability to burn fat becomes much more difficult. The woman who says, I work out all the time now, Dr. Ibrahim, and I watch what I eat and nothing's happening. Well, that woman's probably deficient or low in testosterone, and adding more muscle mass is going to burn fat. Progesterone is the balancing act to estrogen. So a lot of women feel that they may not need progesterone for a variety of reasons, but any woman, especially a woman on estrogen, needs to talk to her doctor about progesterone. And then estrogen. We only use the bioidentical hormones that a woman's body has made since puberty. So we use human estradiol. We place it back in the body in a physiologic manner, never by mouth, never through the mouth, underneath the skin, so that it is absorbed the way it should be without having to go through the liver. And the results are fantastic. Women need to realize that the biggest danger for a woman as she ages is cardiac disease. The biggest risk to a female as she gets older is lack of human estrogen when it comes to cardiac problems. Proper estrogen use, especially with progesterone, is safe. We're not using those synthetic or horse hormones that we've been scared of. Women rightly should be worried about those synthetic and horse hormones. We don't use them at Biltmore Restorative Medicine. I can't stress that enough. So please see us. It's a very, very detailed subject. It's something that you need to speak to your healthcare provider and find a physician that has used bioidentical hormones for years. It's very important.